Does everyone hear me? Hello?
Yeah, we can hear you.
Okay, perfect. Okay, so on a place that you can maybe write, I'm gonna test you guys on about 40 pins in total, and we're gonna revise them after, or I'll send you the answers. But hopefully you can benefit from this test. Okay, so the first one from our pins list is this one right here. Okay, the second one is this one right here. Then the third one, this pin right here. For the fourth one, just give me a second, more people are joining in. Okay, so again, for the people who just entered, that's number one for the pins. That's number two. This is number three. Or number four. It's this muscle right here. Five, we have here the spin. The one after is this one. All right, next. It's this one. The one after is this. Okay. The next one after, we would go down on the lower limb, and I would need this artery right here. Okay, the next one after it is this artery right here. Okay, moving forward, we have this artery. Okay, the next pin would be this important landmark that I'm going to have bordered here. That's our next pin. The one after it, sorry, just give me a second. One after it would be this muscles. Next is this muscle right here. Okay. Mm, the one after is second. Yes. The one after is this one. Then we need this. Okay. For the next muscle, we would need this one right here. Then we would need this one. The next one after that is these two heads right here. Next, we'll go a little bit on top. And the next pin that I would test on is this one. Going further, we would need this muscle right here. Next, the longest muscle in our body, right here. After that, I would need this one here. Just on the bottom of it, we have another muscle on the medial side posterior compartment of the leg here. They kind of have similar names. Just the one after this one sits below the gastrocnemius. The one after that, I would need this one. Then we have this one right here. Moving forward, um, this one, not necessarily here. This one, for the first muscle in this compartment. Then we have this, and then this. One, two, three. Okay. Then I would need this star muscle, but I think you know what I'm talking about here. And then after that, I'm going to open the abdomen a little bit. And I would need this ligament right here. After this ligament, I would need this part, all of it. What is it called? Okay. This ligament, this part. Then we can go to some organs, such as this. This is your next pin. And then we would need, wait a second, right here, this organ. Here. And finally, here, this organ. And that's the end of the pins list. So I will go back again and revise them quickly. Just so you know that you have any mistakes, you can correct them. So for the first muscle that we asked for, it's the multi Then I asked for latissimus dorsi. Next one is levator scapulae. The one after that, no, here, rectus abdominis. Next was rhomboid major. And then rhomboid minor. Just after that, we removed this, and I asked for serratus posterior inferior. The artery is this in this region that we asked for was popliteal artery. And then after that, we went here. It was like this. Anterior tibial artery. And on the back, the posterior part of it was the posterior tibial artery. And then the popliteal fossa. Here, we asked for the interosseous muscles, the dorsal interosseous muscles of the foot. I then asked for this muscle, the adductor hallucis. Then we asked flexor digiti minimi of the foot. Flexes the smallest toe. And then we asked for the flexor digitorum brevis of the foot. And then, of course, we went to ask for the longus. I think it was this one. No, not this, sorry. Yes, yes, it was this one. We asked for both of those pins. This one was flexor digitorum longus of the foot. It's the longest one, so it goes from here all the way. That's why it's longest. And then we asked for the hallucis longus. Of course, there's a brevis just close to it, as we know. After that, we asked for the gastrocnemius. You have a lateral head and a medial head. The ones closer to the obturator foramen, first you have here the obturator internus, and on the opposite side, internus, hence inside, kinda inside. That's the externus, but you have the internus on the inside. And now I can show you. Just give me a second. With the arteries, and it covers that part, so it's probably going to be here. We hide this. That's the one, the obturator internus, because it's on the inside of the pelvis. The externus covers this side, so it's on the external part of the pelvis. Then we asked for the longest muscle of the body, which is this, sartorius. We went after that to the posterior compartment, semitendinous and semimembranous. Of course, after that, we went to the soleus. Under the soleus, you will have one of the pins that we did, which was this, tibialis posterior, and then the anterior of it, tibialis anterior. Then we went here to ask not for the rectus femoris, but vastus intermedialis, laterally vastus lateralis, and vastus medialis. Then we had interest here, iliotibial tract, that joins tensor fascia lata. Okay. Then we went into the organs, and I wanted to have the liver falciform ligament. This part is the greater omentum. Here is rectum. The organ found on your left side in the abdomen. Let's see here. Oh, yes. Okay, so I will just remove here. The respiratory is the spleen. So remember, spleen is on the left side of your body. Liver is on the right. So that was the spleen. And then finally the gallbladder. Okay, guys, so this is a very simple list. It's about 37 pins that we have tested. My meeting has no time left. Please, if you have any questions, shoot me a message, okay? Enjoy your night for now.
Thank you so much.
No problem.
Thank you.